If you're dealing with low back pain, numbness, tingling down the legs, sciatica, I'm going to let you in on something. You don't need an epidural. You don't need injections. You don't need trigger points. There are healthy ways and natural ways that we can fix this and resolve this. I'm Dr. Will Carpenter with Revival Health and Wellness. And when we look at a spine like this, when this disc is broken down, it's due to a couple things. So first, let's just talk about how joints actually work on our spine. So this is what's called a motion segment. We have our bone, our disc, our bone, and then these nerves that come out, okay? Now, the disc, this is a shock absorber. It's kind of like a little jelly donut. And normal joints should move nice and smooth and in tangent with each other. But we get first things called subluxations. That's just a big word for a misalignment. Now, those misalignments are small little misalignments that can happen due to big traumas like slips, trips, falls, and even car accidents, or even repetitive traumas. So the way we sleep, sit, poor posture. And as those bones shift, they're very acute. They can cause slight pain, discomfort, maybe some achiness. And we can correct those pretty quickly and pretty easily. We just got to get those joints moving. So you can do simple things like chiropractic adjustments. You can do foam rolling, stretching. That does some pressure release within those joints. But the problem is that if those go uncorrected, not only the joint stays static and it gets stuck, but by not having that motion, the joint becomes dry. It starts to not have that hydration. And you know, my saying is motion is lotion. So the more motion that we have, the more mobility, the more hydration, more nutrients we get back into that spinal area. Now, the problem is that if we leave those uncorrected, not only the joint becomes stiff and starts to break down, but the disc starts to have some problems. So we can get things called disc bulges, disc herniations. It's where that jelly starts to squirt out and it hits that nerve, okay? That hitting of that nerve is what's causing that pain, that numbness, that radiation down the leg. The problem is here, but right here, but the symptoms are down the leg. So it's kind of like we step on a hose here, we're not getting that flow, okay? And so when we do things like epidurals or trigger points, all we're doing is we're decreasing inflammation here, but we're not addressing this disc, okay? And if disc bulges and herniations go for too long, what happens is that disc doesn't like it, the body doesn't like it, and so those discs start to dry up, and we get things called degenerative disc disorders or diseases. And that's what's happening here in this case. You can see through here, these discs have some hydration, they have that padding and cushioning, and down here, it's almost completely bone on bone. And those bones are starting to rub, that disc has dried up, we don't have that hydration back in there. So we offer a therapy called vacuum decompression therapy. And what that does is if we have that disc bulge, what it's going to do is it slowly opens up that space and it pulls that disc back in to take pressure off those nerves naturally without any sort of injections or even surgery, okay? So in our office, what we do is we do an assessment to determine, one, what's going on in your spine, what level of pain or irritation you're having. Is it purely just a subluxation? Is it a disc bulge or herniation? Or is it disc degeneration? The treatments are definitely different depending on that case, but what we have found is that, especially with disc bulges, herniations, or even that disc degeneration, our vacuum decompression therapy helps not only take pressure off those nerves, but start to rehydrate those discs. We will sometimes also combine that with what's called soft wave therapy or nutritional interventions. Our discs are made of type 1 collagen. By age 20, that amount that we have in our body decreases by 1% per year. So even supplementation with collagen products can help with that healing process and speed that up to help put some of that padding and that cushioning back in there. So again, if you've been suffering with disc bulges, disc herniations, you've had an MRI, you've maybe tried conservative care, you don't want to go under the knife, you don't want injections, this is perfect for you. Dealing with disc problems, back pain, that's our bread and butter. We see it on a daily basis. We see hundreds of patients per week with disc bulges, herniations, and we're getting tremendous results with our decompression therapy. So again, if you are looking for a natural resolution to not only get a healthy disc, a healthy spine, a healthy nervous system, quality life gets better, range of motion improves, pain reduces, sleep gets better, walking, standing, sitting improves naturally, then this is for you. So click the link below. We're offering a very special offer to a limited number of patients in our area that want to get checked out. It's a consultation, an examination. We're going to test the range of motion. We're going to test the nerves. We're going to test the muscles. We also do a special type of x-rays here in our office, not only to look at the structure statically, so you just standing still, but we also do what's called a motion study. Now that motion study, we're going to have you bend side to side. We're going to take those pictures as you're moving to not only look at the mechanics, but we're going to be able to see how are those joints moving? How are the discs responding to that motion? Because, you know, if we're just standing still and we're taking pictures, it doesn't give us an idea how you're moving through a day-to-day basis. We want to see really, where is your pain? How is it when you bend left, when you bend right? Is it worse left? Is it worse right? Is it better left? Is it better right? We're going to be able to see exactly how those joints are moving and be able to see, hey, the joints are being stuck here or here. These are the areas that we need to address, because every time that we treat, we pull x-rays up. We also are going to calibrate our machines and focus in on those areas that need it, but avoid the areas that are healthy. So with that being said, if this is something you've been suffering with, you want our help, click the link below and apply today.